And did you know that the well-being of parents directly impacts the mental and behavioral health of adolescents? It's a profound statement, but one that's backed by a wealth of research. When parents struggle with their own mental health, it can cast a long shadow over their children's lives, shaping their adolescence and even influencing their adulthood. Children are like sponges. They absorb everything around them. They are finely tuned to the emotional states of their parents. And when a parent is struggling, it can create a ripple effect. The child may feel confused, anxious, or helpless. They may start to mirror their parents' behaviors, or they may act out in an attempt to cope with their unsettling feelings. In families where one or more parents are dealing with mental health issues, the atmosphere can be tense and unpredictable. Adolescents in these families often feel like they're walking on eggshells, never quite sure what will set off a storm. This can lead to chronic stress, which can have a significant impact on their mental and physical health. But here's the thing, parents can't pour from an empty cup. It's challenging, if not impossible, to provide the emotional support and stability that adolescents need when they're wrestling with their own mental health issues. That's why it's critical for parents to take care of their mental health. But it's not just about parents seeking individual therapy or treatment, it's about the entire family system. Mental health isn't an individual issue, it's a family issue. When one member of the family is struggling, it affects everyone. That's why mental health support needs to extend beyond the individual and encompass the entire family. Family support programs can play a vital role here. They can provide a lifeline for families navigating the choppy waters of mental health issues. They can offer education, resources, and support, helping families to understand mental health conditions, learn coping strategies, and access necessary services. So it's clear that family support is crucial for mental health. Now let's delve into what family support programs are. Family support programs for mental health are lifelines, providing resources, education, and assistance to families affected by mental health conditions. These programs are designed with the goal of enhancing the overall well-being of all family members, particularly when one is grappling with a mental health condition. These programs are typically structured around a few key components. First and foremost, they offer an educational aspect. This can involve sessions that help family members to better understand the nature, symptoms, and treatments of various mental health conditions. Additionally, they provide strategies for coping with the challenges that mental health conditions can bring, empowering families to support their loved ones while also taking care of their own well-being. Support services are another key component of these programs. This can include counseling and therapy sessions for families, either as a group or individually. These services provide a safe space to discuss the challenges and emotions related to their loved one's condition. Many programs also offer peer support groups, where family members can share experiences, offer support, and learn from others in similar situations. Family support programs also focus on resource provision. They guide families on how to navigate the often complex healthcare systems, including accessing mental health services and understanding insurance coverage. They can also provide information about and referrals to additional resources, such as crisis intervention services, housing support, and financial assistance programs. Another important facet of these programs is advocacy and empowerment. Some programs equip families with the skills to advocate for the rights and needs of their loved one with mental health conditions. They aim to empower families to take an active role in the care and support of their loved one. Lastly, these programs often strive to build a sense of community among participants, reducing the isolation that can come with dealing with mental health conditions. They may also focus on raising awareness within the broader community about mental health, reducing stigma, and promoting inclusivity. Now that we have a basic understanding of these programs, let's dig a bit deeper. The first component of these programs is the educational sessions. Knowledge is power, as they say, and in the context of mental health, it's no different. A key aspect of family support programs is educating family members about the nature, symptoms, and treatments of various mental health conditions. This understanding can help demystify what their loved one is experiencing, leading to more empathy and better support. But understanding is just the starting point. These programs also teach families coping strategies. Living with or caring for someone with a mental health condition can be challenging. It's a journey filled with highs and lows, and knowing how to navigate this terrain is crucial. Coping strategies can range from stress management techniques to communication skills to self-care practices. These tools help families support their loved ones while also taking care of their own well-being. Education forms the foundation for families to effectively navigate their loved one's mental health journey. Next, we have the support services offered by these programs. One of the key elements of family support programs is counseling and therapy. This can be delivered in group settings where families come together to share their experiences or one-on-one, allowing for a more personalized approach. Counseling sessions provide an opportunity for families to discuss the challenges they face and the emotions they grapple with in a safe and understanding environment. Another crucial feature is the provision of peer support groups. These groups create a platform where families can share experiences and offer support to each other. It's a space where you can learn from others who are navigating similar paths and find solace in the knowledge that you're not alone in this journey. These services provide a safe space for families to express their feelings and learn from others' experiences. By fostering open conversation and shared understanding, they play a pivotal role in the overall well-being of families affected by mental health conditions. Another critical component is resource provision and advocacy. These two elements are paramount in family support programs, equipping families with the tools they need to navigate complex healthcare systems and advocate for their loved ones' rights. First up, resource provision. Imagine trying to find your way through a labyrinth without a map. That's what navigating the healthcare system can feel like for many families. Family support programs act as that much-needed guide, illuminating the path through the maze of mental health services and insurance coverages. They provide families with the knowledge and resources to understand the options available to them and how to access these services effectively. Furthermore, these programs connect families with additional resources like crisis intervention services, housing support, and financial assistance programs. It's like having a trusted friend who knows exactly who to call, what to say, and where to go when you need help. Next on the list is advocacy. Advocacy is about standing up for the rights and needs of your loved ones. It's about making sure they get the care they deserve. But how do you advocate if you're not sure what to say or do? That's where family support programs come in. They provide advocacy training, arming families with the skills and confidence to ensure their loved ones' needs are met and their rights respected. Through this training, families learn how to effectively communicate with health professionals, how to navigate legal and educational systems, and even how to influence policy changes. It's about equipping families with the tools to fight for their loved ones' rights and well-being. But it's not just about fighting battles. Advocacy also empowers families, giving them a sense of control and agency. It shifts the narrative from feeling helpless to being proactive and engaged in their loved ones' care. By empowering families with knowledge and support, these programs enable them to take an active role in their loved ones' care. They turn families from spectators into active participants, advocates, and allies in the journey towards better mental health. And that, after all, is the essence of family support programs, providing the resources, skills, and confidence families need to face mental health challenges together. Lastly, we have community building and tailored interventions. Community building is a cornerstone of family support programs. Creating connections among families dealing with similar challenges can alleviate feelings of isolation and foster a supportive network. But it's not just about internal connections. Raising awareness within the broader community can reduce stigma, promote inclusivity, and make everyone a part of the solution. Now, onto tailored interventions. No two families are the same, and neither are their needs. Support programs recognize this by providing individualized support. This may come in the form of in-home visits, specialized therapy for complex conditions, or assistance navigating legal and educational systems. These bespoke interventions cater to the unique circumstances of each family, ensuring that support is not a one-size-fits-all solution. These components ensure that families are not alone in their journey and receive the specific support they need. So why are these programs so crucial? Well, consider the ripple effect. When one member of a family is struggling with a mental health condition, The entire family feels the impact, the stress, the worry, the uncertainty. It can be overwhelming. That's where family support programs step in. By providing resources, education, and a supportive community, these programs help families navigate the often rocky terrain of mental health. They equip families with the tools to support their loved one while also taking care of their own well-being. And the benefits don't stop at the family unit. By fostering a more understanding and supportive environment, these programs help individuals dealing with mental health issues flourish. They contribute to better mental health outcomes, not just for the individual, but for the entire family. Family support programs play an indispensable role in promoting mental health and well-being in families.